Good afternoon, everybody. We're going to get started, and I want to thank you all for being here. It's a great pleasure to have had the honor of having this event sponsored by probably our longest standing, I was going to say oldest, but that's not right, our longest standing friend in Congress, which is Congressman Jose Serrano. So it's a great pleasure to welcome him here today as a personal friend and as somebody who's been a great supporter of the Institute for Family Health for a long time. Congressman.
Welcome and thank you for the important work that you're doing to ensure a level playing field in our health system. Your community centers are the lifeblood of many of our communities, and they ensure that all patients have the same level of access to high-quality care in their community. You know, one of the things that struck me about Neil a long time ago is that he gets it. And in my opinion, not getting quality health care is unacceptable. We're not in a country where that's an issue. It should not be an issue. And you knew that from the beginning, and you dealt with it in the Bronx. Since centers are the front lines of health care, utilizing primary care to prevent and catch diseases from becoming worse will save our health care system a lot of money, and more importantly, save lives.
So I thank you for all your work, for the Institute that you do in my district and in urban settings like mine, where asthma and diabetes are a commonplace. They're not rare diseases by any stretch of the imagination. And access to primary care and preventive medicine is what this is about, limiting exposure to those things that would cause those diseases. And to thank the Institute, all of you, for the work that you do. It's God's work, and we really, really do appreciate it.
Every time we come to Washington, people say it's really great to hear what's happening on the front lines. So these folks are on the front lines. And what they do every day is really struggle with some of America's most needy communities and their residents. And so we're here really for two reasons. One is to help you understand where the barriers are that require legislative action and to ask for your help, because federal policy really sets the stage for the work that we do, and also, most importantly, for the funding that's available to us to accomplish that work. So the experiences of the people we brought with us today hopefully will help you set the stage for the work that needs to be done going forward. So granted, this is the view of only one organization, but the Institute for Family Health really is a unique organization. And it's unique not so much in each of the components that we do, because everything we do is being done somewhere else, but it's unique in the breadth of the organization. We deliver over 600,000 primary care, mental health, and oral health visits every year in areas from lower Manhattan all the way up through the Hudson Valley. We're training 90 family physicians every year in family medicine. And every day we send over 40 health workers out in the field in rural New York to work with families who are at risk. We deliver medical, mental health, and dental care in New York City school system. We run family medicine departments and inpatient services on the family medicine model in 4 different teaching hospitals. And we're engaged in health services research and policy work in a wide variety of areas. So in summary, then, I ask you to focus on health disparities. It's the #1 health problem in our time. We need legislation to make sure providers serving low-income communities of color have the resources to address these disparities comprehensively. We also need legislation to close the gap and to make sure that health providers offer the same services to all people, irrespective of their source of payment. And with that brief introduction, I want to turn the podium over to a few of my colleagues at the Institute. And the first person I'd like to introduce is a colleague who's been working with us on our Health Disparities Initiative for many years, and the director of our Bronx Health Reach program, Charmaine Reddock.
This healthcare center has not just focused on providing health care, but promoting health in a very dynamic fashion and engage in the community. So How have we done it? We've done it by founding with community partners the Bronx Health Reach Coalition in 1999. And we're a 70-plus member strong coalition consisting of faith-based organizations, schools, small businesses, healthcare organizations, many city and state agencies. So when we first started, in that very small circle where you have individual, we started with that as our focus. We were doing discrete programs, heavily invested in primary prevention, education, information. But because our guiding principle is community-based participatory approach, and we are a community coalition, the community coalition very early on challenged the idea of just focusing at the individual level, really pushed that the organizations from which they come must be involved, and that if the change that we were looking for was not merely programmatic but sustained, then we would need to push into community, talk about community transformation, and push, and for that community transformation to happen, you're talking about policy.
Imagine that when you went to your primary care doctor, without anyone even asking, without you even having to ask, someone asked you about your mood. When you first got in, you did a questionnaire, or the medical assistant who took your blood pressure also asked you how you were feeling. Maybe there's signs up in the waiting room that let you know that behavioral health services are also available. And you can learn that you receive medical care and psychiatric care from the same treatment team that you already know. This is how we do it at the Institute. So the Institute for Family Health has been offering integrated medical and psychiatric services since 1993. That is way before most people had caught this wave.
So the Institute's integrated care model is designed to address the many barriers by underserved individuals seeking care. Some of our many services include translation, transportation assistance, insurance enrollment, case management, and care management. My department collaboratively works with patients and their institute providers as well as external providers to improve their overall care. We help patients in managing their physical health as well as their mental health conditions and the social and environmental factors that influence these conditions. Our care navigators work with patients on the front lines, in their communities, in their homes, to navigate specific support services that they so desperately need, such as securing public housing or accessing nutritious foods to enhance their overall well-being.
All of the wonderful services that Laura and I described for you, they're not all reimbursable. So translation services, care coordination services, case management services are often not reimbursed. And so it can be very difficult for centers to continue to afford those services. So I urge you to consider this in your legislation, to think about the way that same-day reimbursement is structured and allowed by the states, and also to continue the wonderful progress that's been made recently in supporting addiction training and access to medication.
Federally qualified health centers really represent a unique classroom of the future. And that's really what, in many ways, the Institute is providing, and I've been very grateful to, in my career, to be involved in how you can turn the community health center, FQHCs, into the classroom of the future. The Teaching Health Center program was part of the Affordable Care Act. The Teaching Health Center money is given to FQHCs and other community organizations that are engaged in residency training. It was a very innovative idea. We were one of the first 11 inaugural Teaching Health Center programs with our upstate program. The funding of this program is in jeopardy. As I said, it ends September 30th, 2017. The funding initially was at $150,000. Now it's currently only $110,000. A recent report in the New England Journal of Medicine pointed out that residency training requires roughly $150,000. So those of us who are engaged in this training program, training the next generation of physicians, is doing it at a loss. And it's that kind of financial stress that already community health centers are faced with that make it harder for them to continue this engagement, not only in the service of their patients, but also training the next generation of doctors. So what we want to do is promote the growth of this program, and today what I'm asking for is your help in making the Teaching Health Center program not only restoring the current proposed funding of $150,000, but also expanding this, because we really believe this is the model that's going to help us to design and staff the healthcare system that we need for the future.
Just to emphasize that when you do have an idealistic heart and you believe truly that medicine and healthcare can be delivered to patients with dignity and higher quality, and you meet a bunch of people like this is where you're really incentivized and motivated and inspired to create change. And I didn't believe a place like the Institute existed. It does, and we are inspired to do more and more things every day. And we just need more residents. We need more attendings. We need more people like this. If residents are given the opportunity to work in the community and are given the resources, just like the ones that we mentioned, believe me, more and more people will want to train in these programs. It's just that there's just not enough.